Obstructive sleep apnea, OSA, is a common and serious sleep disorder where a person's breathing is repeatedly interrupted during sleep. Here's an overview of key information about OSA. What is obstructive sleep apnea? OSA occurs when the muscles in the throat relax excessively during sleep, causing a temporary blockage or collapse of the upper airway. This leads to repeated interruptions in breathing, often lasting 10 seconds or more, known as apneas. These episodes can happen hundreds of times per night, leading to fragmented sleep and reduced oxygen levels in the blood. Risk factors. Obesity. Excess weight, especially around the neck, increases the likelihood of airway obstruction. Age. OSA is more common in adults, particularly those over 40 years old. Gender. Men are more likely to develop OSA, but the risk for women increases after menopause. Family history. Genetics can play a role in the development of OSA. Smoking and alcohol use. Smoking can increase inflammation and fluid retention in the airway, and alcohol can relax throat muscles. Anatomical factors. Enlarged tonsils, a thick neck circumference, or a narrow airway can increase the risk. Medical conditions. Hypertension, diabetes, heart disease, and other conditions are linked to higher rates of OSA. Symptoms of OSA. Loud snoring. Snoring is often the most noticeable symptom. Pauses in breathing during sleep, often noticed by a bed partner. Excessive daytime sleepiness, due to frequent awakenings during the night. Morning headaches. Low oxygen levels during the night can lead to headaches. Difficulty concentrating. Cognitive impairment due to poor sleep quality. Irritability or mood changes. Complications of OSA. If untreated, OSA can lead to several serious health issues. Cardiovascular problems. Increased risk of hypertension, heart attack, stroke, and arrhythmias. Metabolic issues. Increased risk of diabetes due to disruptions in glucose metabolism. Daytime fatigue. Reduced alertness can increase the risk of accidents, particularly while driving. Complications during surgery, due to the effect of anesthesia on respiratory function. Poor quality of life. Chronic fatigue and irritability can impact work, relationships, and mental health. Diagnosis is typically based on clinical evaluation. A doctor will assess risk factors and symptoms. Polysomnography, sleep study, the most definitive test performed in a sleep lab where various body functions, brain activity, eye movement, heart rate, oxygen levels, etc. are monitored during sleep. Home sleep apnea testing, HSAT. In some cases, a portable device may be used to monitor breathing patterns at home. Lifestyle changes. Weight loss can reduce airway obstruction. Sleep position. Sleeping on the side may help alleviate snoring and breathing problems. Avoid alcohol and sedatives before bedtime as they relax throat muscles. CPAP, continuous positive airway pressure, a device that provides a steady flow of air through a mask to keep the airway open during sleep. This is the most common treatment for moderate to severe OSA. BiPAP, bilevel positive airway pressure, a similar device to CPAP but with two pressure levels, one for inhalation and another for exhalation. It's used for more severe cases or those with certain lung conditions. Dental devices, also called mandibular advancement devices, these help keep the airway open by repositioning the lower jaw and tongue. Surgery, in severe cases, or if other treatments are ineffective, surgical options like uvulopalatopharyngoplasty, UPPP, tonsillectomy, or even jaw surgery may be considered. Medications. There are no specific drugs for treating OSA, but some may be used for associated conditions like allergies or nasal congestion. Maintain a healthy weight and exercise regularly. Sleep on your side rather than your back. Avoid alcohol and sedatives before bedtime. Quit smoking, as smoking worsens airway inflammation. Treat nasal congestion if you have allergies or other conditions that affect airflow. If you experience symptoms like loud snoring, choking, or gasping during sleep, or excessive daytime sleepiness, it's important to consult a healthcare provider. Untreated OSA can lead to severe health complications, so early diagnosis and management are key. If you or someone you know is at risk of OSA, it's important to seek medical advice to explore appropriate treatment options.